Good day, everyone. You're watching the Nursing Network, empowering care, informing minds. I'm Christian Peronilla, bringing you today's top health headlines from around the world. We begin right here at home, where local government units are stepping up in the fight against dengue. For more details, here's our correspondent Cyrus reporting live from Manila.
Here in Manila, the local government has intensified its anti-dengue campaign as the number of cases continues to climb during the rainy season. Mayor Hani Lacuna has directed the Manila Health Department and barangay leaders to increase fogging operations and cleanup drives across all districts. In a creative move, Barangay Vision Hills in Mandaluyong City is offering a small incentive, 1 peso for 5 mosquitoes caught, to encourage the residents to help control mosquito breeding sites. The Department of Health reminds the public to follow the 4S strategies: search and destroy mosquito breeding sites, secure self-protection, seek early consultation, and say yes to fogging outbreak areas. With combined efforts from the government and the community, officials are optimistic that dengue cases can be reduced in the coming week. Back to you, Christian.
Thank you, Cyrus. It's great to see local communities working hand in hand to fight dengue. Now, from community efforts to national healthcare improvements, the Department of Health is expanding urgent care access for Filipinos through its new Bukas centers. For more on this story, we go to Jessero.
Thanks, Christian. The Department of Health continues to strengthen healthcare accessibility through the Bagong Urgent Care and Ambulatory Service Centers, or BUCAS centers, now being rolled out nationwide. These centers aim to provide faster outpatient and emergency consultations, especially in rural and underserved areas. Just this month in Bicol region, more than 1,000 residents benefited from free checkups, TB and HIV screening, maternal care, and mental health services. Health Secretary Teodoro Herbosa said this initiative supports the Universal Health Act, ensuring every Filipino has access to quality care without the burden on high medical costs. The DOH also continues to partner with local government units and university and community nurses to bring healthcare closer to families in need. Back to you, Christian.
Thank you, Jessero. It's inspiring to see how the Universal Healthcare Act continues to bring vital services to our communities. And speaking of health beyond borders, vaccination remains one of the world's most powerful tools against disease. For the latest on global immunization trends, we turn to Demrat, joining us with updates from the World Health Organization.
Thank you, Christian. Globally, the World Health Organization and UNICEF report that vaccination coverage for children has remained stable, with 89% of infants receiving at least 1 dose of the DPT vaccine, which protect against diphtheria, tetanus, and pertussis. However, an estimated 14 million children worldwide still have not received a single vaccine dose, most of them living in areas affected by conflict, poverty, or misinformation. WHO officials warn that unless countries invest more in a community-based health systems and vaccine awareness, outbreaks of preventable diseases such as measles and polio could arise again. As healthcare providers and future nurses, this reminds us the importance of patient education and trust, ensuring that accurate information reaches every family. Back to you, Christian.
Thank you, Demrat. From dengue prevention efforts in our local communities to national healthcare expansion and the global push for vaccination, these stories remind us that health begins with awareness and action. And that's all for today's broadcast of the Nursing Network, empowering care, informing minds. I'm Christian Peronilla, together with Cyrus, Jessero, and Demrat. Thank you for joining us. Stay informed, stay compassionate, and as always, stay healthy.